Good afternoon. Thank you for coming out on a Saturday afternoon to listen to a candidate for office speak. I'm grateful that you would take time out of your weekend to do that. To Jeff and to all of those who helped organize this event and to encourage you to be here, thank you for that leadership. We appreciate it very much. I had a chance to share this story with this table over here as we were sitting and visiting before the program started, but on one of my trade missions to China when I was last governor, we took the largest delegation, state delegation, ever to go to China on a trade mission. And the Chinese government gave us an incredible hospitality. They greeted us and were able to show us around in really remarkable ways. But one of the events was a very elaborate reception in Beijing, and we were in a historic building, and the idea for the reception was the Minnesota delegation was on one side of this very large, ornate door, historic door, and the Chinese delegation was on the other side of the door, and the door was closed. And this federal official that was traveling with me as a matter of protocol from the U.S. side had more seniority or stature than I did, so the rule was he would be the one to open the door, and then the Chinese and Minnesota delegations would come together for reception and dinner. It was supposed to be a ceremonial moment. But nobody told him as he was going to open this door that he was supposed to push the door open. Instead, he grabbed this big gold ornate historic doorknob and yanked on it, and he ripped it right out of the door. And he was standing there with the doorknob. And then I got to the door and I said, let's gently open the door. Pushed it open. So that's a true story, and a story that I think sort of symbolizes the need for our country and China to open doors in ways that are constructive and friendly and mutually beneficial. And these types of dialogues for the Chinese Americans and American leaders and our counterparts in China, of course, are so very, very important. But again, thank you for having me here today. I was asked to touch on 3 or so of the most important issues or challenges or opportunities facing our great state, and so I'll do that and then leave time for questions as well and some dialogue. But I want to start with just talking about Minnesota's quality of life. For those of you who've had a chance to travel either here or internationally, I think you'll know, either because of what your eyeballs tell you or because what you can read in terms of the quality of our state, that Minnesota's quality of life is pretty high. We have a pretty diverse economy in Minnesota with high-tech businesses, medical tech businesses as an example, agriculture, mining, and so much more. A very diverse economy. We have a highly educated population. We have a population that on per capita income compared to other states does pretty well. We have one of the highest concentrations of Fortune 500 companies per capita headquartered in our state. We have high rates of volunteerism, high rates of civic engagement, high rates of attendance at church or people's places of worship, high rates of engagement in voting, and the list goes on and on and on. But if you pick measures of sort of civic health, if you will, Minnesota ranks quite high on many of those measures. But for most people, in terms of their quality of life, it is important for quality of life for people to have access to good jobs. And so one of the things I want to talk to you about today is what we can do together, what I can do as the next governor of the state of Minnesota to keep and grow more good paying jobs in our state. And so that's issue number 1, and that is to improve our job opportunities as a measure for quality of life in our state. And if you want to ask, how do we get more jobs in our state? Usually the answer to that question doesn't come from people who've never done it. The politicians, the bureaucrats, or people who've not been in that space. And so I go around the state and ask people who actually provided jobs, what can we do in Minnesota to make it more likely that you'll start a business here, grow your business here, add more employees here, buy more equipment here, build a building here, conduct research and development here, innovate here, take risks here. And the answer to the question varies a little bit from company to company or entrepreneur to entrepreneur, but whether the business is small or medium or large, they basically say some version of, can you please do something to make the load lighter from government, not heavier? Can you do things to encourage me to be growing and expanding in our state, not discouraging me? Or more bluntly stated, many of them will just say, can you get the government off my back? And some talk about taxes, some talk about regulation, some talk about the slowness or incompetence of government or how it lacks common sense. But the overarching theme is, can you make the load from government lighter, not heavier? So it's more encouraging to me as an entrepreneur or a small business person or somebody who might want to start or grow a business in our state. So one of the things that comes up in that regard is taxes. And you may have noticed Minnesota has the third highest income tax in the country. We have the fifth highest overall tax burden in the country. We offer no preferential rate. I suppose the children don't follow these details. For capital gains, we tax all capital gains as ordinary income. Our state tax is out of line with other states. We have high property taxes, high sales taxes, and the like. And so we have a great state, but we can't be so smug about how great we think we are that you can price yourself out of the market and not think it doesn't have an effect on where people decide to start and grow businesses. So I think we're at the inflection point, and we need to bring tax relief forward in Minnesota, and I'll do that as the next governor. So that's number one. Number two, besides having the jobs available, we have to have our citizens ready in terms of skill and education to be ready for those jobs. And we talk a lot in Minnesota and across the country about income inequality, but you know that income inequality is highly correlated to education and skill inequality. And one of the best things we can do to improve income equality in our country and in Minnesota is to improve the education and skill level of our population. The next generation that's coming up, and also for adults who may want to train or retrain for another opportunity. So we have a whole agenda around skilling up, improving the educational outcomes in the state of Minnesota. And I won't go through it all in the interest of time, but let me give you a few examples. Number one, I think you should be able to have school choice. Parents and children should be able to choose where they want to go to school based on their learning and family values, the types of learning that they would like to do. I don't think you should be condemned to a government monopoly school based on the zip code of the parents that you were born to, and have that be your only choice. I think government should fully support your education, particularly at the K-12 level, but that money should go to the parents and the children and allow them to choose whatever school they want. And for many, that will still be the public schools. For some others, that might be a public charter school. For some others, that might be a private school. For some others, it may be something else. But I think opening up choice and freedom and various options in the delivery of educational services is a good thing. One size fits all is not the right answer. Two, you know that we want to encourage as many people to go on to college as possible and get a 4-year college degree, hopefully one that's lined up to the job market, it's relevant to the job market of the future. But nationally, half the people who go to college to try to get a 4-year degree don't make it, don't get the degree. They drop out. And in many cases, they drop out deeply in debt before they get the degree, and they end up in jobs that pay not as well or less than people who went to a 2-year technical or career experience. And so we don't want to discourage the 4-year college degree, but we made a mistake in the United States and in Minnesota taking technical training out of the Minnesota and American high schools. I think we need to re-celebrate and re-embrace the traditional technical fields, electricity, carpentry, plumbing, skilled trades, but also the new kind, medical technologists, mechatronics, people who are involved in cybersecurity at a less than 4-year degree. There's tremendous career and educational opportunities that are available for 2-year degrees where students can get through faster, it's more affordable. In these cases, they're almost always guaranteed jobs, and in many cases, they pay more than the jobs that are available to people who tried to get a 4-year degree and didn't make it. So bringing technical and career opportunities as an option into the high schools and into our 2-year colleges back in a modern way is really important. 3, I love our teachers. I hope you do too. They work in difficult environments. It's not easy to be a teacher. They are not overpaid. But I also want to make sure that we attract the right kind of talent to teaching. And so as you think about the kind of talent we need, if you want to need chemists and physicists and and biologists and people who are advanced mathematicians and others to come in and teach, we need to make sure that we pay them in a professional manner, both in terms of the level of pay, but also in terms of the value of the pay. Right now, if you go to a public school, teachers get paid on a grid. They get paid on just seniority, how many years they've been there, and what certificate or degree they have. It's a little grid, which is fine, but you could be the greatest, hardworking, most impactful teacher who's teaching physics, and you get paid the same, potentially, as the gym teacher who's teaching kickball, out on the playground. We want to make sure that we're able to professionalize teacher pay so that our most in-demand, most effective teachers are paid more. Because, after parents, the number two determining factor after parents of how a child's going to do in school is the preparedness and effectiveness of their teachers. And having a program around making sure our teachers are prepared, trained, and professionally paid is really important. And that's something I'll be focused on as governor as well. There's more in the area of education reform, but we need to fund our schools, but we also need to hold them accountable for better results. And as long as I'm on education, let me just discuss this data disaggregation issue that was brought up earlier. I think the level of detail that the state is imposing in terms of that data collection is ridiculous. I think that law needs to be rescinded and reworked to make sure that it is not raising the kinds of concerns that Jeff mentioned in his introduction, and I'll work with you to make sure that that happens. The third thing I want to touch on by way of just three priorities, there are many more issues, but we'll just leave it at these three. So we talked a little bit about tax relief. We talked about education reform and what those two things mean to the future of job readiness and workforce readiness and quality of life and career opportunities in our state. But we also need to make sure that we do one other very important thing. That is, we need to bring down or hold down the cost of health care insurance in the state of Minnesota and in our country. It is going up too fast. It is making families stressed. It's making employers stressed. People, when you talk to them, are just saying, I can't keep up. And we talked a little bit earlier, Jeff did in his introduction, about people who are feeling squeezed. And so the wealthy are going to be fine. The poor in Minnesota have access to some pretty good programs, at least compared to other states. There's a lot of people in Minnesota who are working, sometimes a mom and a dad working very hard, but they can't get ahead. They're working very hard, sometimes two jobs, can't get ahead. Or if they are ahead, they're just a little ahead. And one missed paycheck or one bump in the road, and they fall back behind. And one of the things that's pressuring them is health insurance. So again, people's eyes glaze over when you get into the details of how to reform health insurance, so I won't go into it in great detail. But we have a system now where the doctors get paid for volumes of procedures. And no matter how good of a person you are, Zoe is a wonderful person, but she's a doctor, and she gets paid for performing volumes of procedures. What do you think Zoe's going to be thinking about? More volume. If you get paid for volume, you're going to produce volume. And if you're a patient and you don't really know the price of things, or you can't really find the price of things, and some third party manages the relationship, that's really not a market. So our Democrat friends, what they want to do is have our government take over the whole healthcare system. If there was a Democrat candidate, he or she would be telling you about something called single-payer healthcare. And what they mean by that is they want the federal government or the state government or both to take over all of the healthcare delivery system. I think that's a really bad idea. Most of what our government runs, they goof up. We do not want them fully in charge of your healthcare. So I want patients and doctors to be in charge of healthcare in a market where doctors can be rewarded not just for volumes of procedures, but for better healthcare outcomes. We want patients to have prices available right away, up front, rather than a month after the fact. If you go to the grocery store, if I stop at the Cub on the way home from this meeting and I grab a gallon of milk, I can see the price right on the dairy case. I don't take the gallon of milk home to my house in Egan and then wait, and then a month later in the mail, a bill comes for the gallon of milk, and I'm surprised by the price of the milk. And then I don't get a separate bill after that from the dairy farmer who milked the cow. And I don't get a separate bill after that from the person who drove the milk to the dairy. And I don't get a separate bill from the person at the dairy who pasteurized the milk. And our healthcare system is ridiculous. You get bills a month or later after the service. You then only realize the price. A lot of times the price isn't even what's listed there because your insurance company or somebody else has cut a side deal that is the real price they're paying. And then you get a different bill from the anesthesiologist, a different bill from the doctor, the hospital. It's really quite confusing. So if Zoe is my doctor, we want to require her to tell me up front what the price is. Real simple, at least for things that are going to be schedulable and predictable. We want to pay her not just for how many procedures performing, but for making people better, for better quality outcomes. And then I want to give me a incentive to use the system wisely. So if I'm going to get my knee replaced and Zoe says, all in, I'll do that for $30,000. The whole thing, $30,000. All the tests, all the preparatory meetings, all the blood tests, the surgery, the post-aftercare, $30,000. And if Yi is also an orthopedic surgeon, and she says, wait a minute, before you go to Zoe, I'm just as good as Zoe, here's my quality measurements, I'll do it for $20,000. And I'm like, well, I'm going to Yi. Because they're the same in quality, and Yi's $10,000 cheaper. I'm going to Yi. And so if I choose to go to Yi and I just save somebody $10,000, Yi and I should split that $10,000. She's got an incentive to be efficient and offer a better price. I've got an incentive to go to Yi because I'm going to share that $10,000 with Yi. That's called a shared savings model. And that's the direction, one of the things we need to do in our healthcare delivery system. And again, it only works for things that are schedulable and predictable, but we've got to get pricing information in a user-friendly way in the hands of consumers. We've got to give doctors incentives to offer pricing and quality that people can understand up front. And then we've got to give people, patients, knowledge so that they can be smart shoppers and have an incentive to use the system more wisely than they do now. That's a little bit of an oversimplified example, but that's the direction we have to head. So let me close with that and just say thank you again for having me here today. As Jeff mentioned, the primary in Minnesota is August 14th, which is just now 10 days away. You don't have to vote just on August 14th. If you want to, you can. But early voting is open now. So if it's more convenient, you can go any Monday through Friday to either the city hall or wherever the election office is in the area in which you live. And they'll give you a ballot, and you can vote anytime between now and August 14th. And a lot of people vote in November, but very few people vote in August. So, this group could be the margin of victory in the primary. So I hope that you'll go vote. Thank you for listening. I'll be happy to take your questions. We have time for some questions. If there are some, yeah, please.
Please, thank you so much. And the rest of the part will be kind of like a question and answer. And before this event, we've collected some questions from our community, and we're going to first start with those questions, and then we're going to open up to our audience. Thank you so much.